Hello, my name is Dr. Angela Dispensieri. I am a professor of medicine and laboratory medicine at the Mayo Clinic. Today I'd like to tell you about a paper that will be published in the Mayo Clinic Proceedings. The title is called The Treatment of Immunoglobulin Light Chain Amyloidosis, Mayo Stratification of Myeloma and Risk-Adapted Therapy, or MSMART, Consensus Statement. This is a consensus statement that about treating patients with AL amyloidosis. Immunoglobulin light chain amyloidosis is a rare plasma cell disorder. This is a disease that, if untreated, will result in death. It's a complex disease and it's a rare disease. That combination of being both complex and rare make it very difficult to conduct randomized clinical trials. This leaves us in a position where much of what we know about treatments for patients with AL amyloidosis is borrowed from a cousin disease called multiple myeloma. The other portion of non-randomized clinical trial data, or even not small phase 2 data outside of that realm, comes from large case series. This makes it very challenging to treat patients with AL amyloidosis, and that's the basis of our work. So what we've done is we've compiled the evidence that exists, that's been published, and synthesized it and digested it and graded levels of evidence and made a treatment algorithm. These algorithms have the benefit of the expertise of more than 24 physicians that specialize in AL amyloidosis. The manuscript starts out reminding the reader that not all amyloidosis is AL amyloidosis. There are a variety of different types of amyloidosis that require very different treatment strategies. We also discuss the importance of risk stratifying patients, and we give the parameters by which risk is assigned. The bulk of the manuscript deals with our recommended treatment algorithm. We start out with dividing patients into transplant eligible and transplant ineligible patients. So moving on to the structure of treatment for these patients, again, we divide patients into those who are transplant candidates and those who are not. We discuss the criteria by which we make the decisions whether a patient is transplant eligible or not. And then we also talk about the excellent options that exist for those patients either not interested in transplant or for whom transplant is not an option. We also remind physicians to consider drug effect rather than disease progression when a patient starts failing after having been started on a new treatment. Though it is discouraging that much of what is standard therapy in patients with AL amyloidosis is not truly evidence-based, or it has a low level of evidence associated with it, I think that this document will help physicians better understand the literature. We also hope that this manuscript will make physicians aware that there's been a lot of progress in treating patients with amyloidosis, and that there are a number of very interesting new therapies and therapeutic options on the horizon for these patients. I would like to mention that the fact that we have this algorithm should in no way discourage people from putting patients on clinical trials, because this is indeed the gold standard for these patients. Nor should these recommendations dissuade physicians who have little experience in treating patients with AL amyloidosis from referring these patients to centers of excellence like the Mayo Clinic. Even in the best of hands, because these patients are so complex, treatments may not work, and there may be significant morbidity and mortality. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.